nation. Where would you say we are as a people, and to put this question of the finance bill in totality and into context?
I mean, first of all, I will say where the real estate construction sector is. You know, for us, we slump into election, yeah? And usually the year after election, we are very optimistic, we're very sanguine. A year after election, everyone gets their money out, Daktari wants to build and all these things, so everyone is looking forward to the next couple of years. We began the year well. Of course, we began with the capital gain tax tripled, but this is the decision, from 5% to 15%. I read a report yesterday that because of that alone, the tax revenue has declined by 13%. Again, telling you, when you increase taxes, it's not rocket science. Yes. You increase taxation, it's an effect. Yeah. But look, the built environment is optimistic. The KNBS report, we slumped last year in growth. We were very optimistic this year. That's why we will not take lightly the content of this bill, because it's going to affect the construction industry. And when you affect the construction industry, you affect the industry economy. I've heard the PH say, you know, this levy is about creating jobs. And if you want to create a job, inject into the built environment, the construction sector. But then you're injecting and taking a lot out, that you're stagnating it. James, we are not in a good place. That is the truth. The country, everybody, the villages in the city, we are straining. That's the truth. And that's why this noise about this finance bill, the government cannot re-roll its people. It has to listen, because the pockets of people are tight.
Let's take the government argument that the salaried people should, you know, be good people, if you like, and offer a bit of their money so that we can build houses. What's the worst thing with building houses for everyone?
Look, if that is the argument, then change the name of the tax. Change it to a patriotic levy tax. Allow us to be patriotic then, because you want us to be patriotic to help people below. Call it a patriotic levy. I will gladly say, take my 1,000 to help people. But when you call it housing, then we in the real estate begin to scrutinize that housing levy and whether it will succeed in building. And if we were to go into numbers as well, even if the government gets this 9 billion per month, I could demonstrate that it will struggle to achieve the housing it wants to achieve.
I want to come back to with the numbers, but let's come back. 9 billion on how we look at the numbers. Davji, what's the worst thing with where we are currently? You know, you represent doctors, and others who are representing sort of other sectors. Where are we as a society in terms of, you know, what we can build, what we can do together, and why are doctors so opposed to this? What's that one thing that makes you opposed to this thing?
You know, if you look at Article 43 of the Constitution, it has two things, two rights: the right of access to healthcare and quality healthcare, and the right to access, the right to housing. And if we go down to look at this last survey in the country, 47% of the Kenyans own houses. It's just 6.6% of Kenyans that are homeless. That means 95% actually have a house where they sleep. Regardless of the status of that house, is a house. But when you look at the status of healthcare in this country, it is dysfunctional. You will go to an hospital today and you will not get care that you need, the public facility. You'll be forced to actually visit the public hospital and get down to the private facility. Because number one, there are no doctors in the public facilities that have been employed. We have a shortage of over 50,000 doctors that will take this country up to 50 to 60 years to actually achieve that. And at the same time, with that shortage, we have 4,000 unemployed doctors. We have a situation where interns have to demonstrate to be posted. They have to demonstrate to be paid. So we look at a misplaced priority in the government. First of all, there's no access to healthcare for Kenyans. It is only for those in the state offices and I would say upper middle class that will access the healthcare because they have FT private insurances that takes them to private facilities. But for the Kenyans, like you and me, in this particular public facility, they will not get care. And that's why we see many patients being detained in the hospitals after after going to those particular facilities. Many people will sell their lands and go into contribution. There's so many mchangos that we see every day. So when we focus so strongly on housing now, and we leave that health that you need to have to stay in that house becomes a problem. For the doctors and for other workers, the reason why we have come strongly to oppose this housing levy, it's not only a housing levy issue. We have housing levy here. We have NHIF, as I said, which actually takes 2.75% of your gross salary. We have the NSSF. So all these, in your payroll, you realize that more than 25,000 is deducted. This is despite the stall collective bargaining agreements that we have with counties and the national government. This is despite letters that come from Salary and Remuneration Commission that you cannot have any salary increase because they froze any increment because of COVID. So it is very funny that the government will demand money from these particular pay slips and they don't want you to have any changes on it. So as a union, we came out very strongly and say, no, it's called daylight robbery. You cannot come to our pay slip when we work and do everything, and again, you do not want a change. So that's why it is, we don't take individual responsibility. It is all the doctors. We've had our meetings with the branch leaders, we've had a sitting, and we analyzed the benefits that we're going to get from this housing levy. We could not understand it. Yes.
Kathambi, you almost have the last say on this question of where we are as a country and in terms of our economy and what you're hearing vis-a-vis this finance bill and what it's proposing. Where does it sit? Does it sort of project a government that says the economy is doing well, so you should, give back a bit? What does it say the government itself tends to restrain itself? Do you see any of those things? Where do you think this finance bill is the best way to project what's happening here?
Well, I mean, the truth is it's not the best finance bill, but the reality is that we're in deep debt, right? The government needs to raise money somehow, and so we are seeing all that sort of the pressure to finance the government reflected in the finance bill. In terms of the housing fund, and I think I'll disagree with this gentleman in terms
Please
of...
go ahead and disagree.
Yes.
Yes.
First of all, I mean, let me preface by saying that I don't agree that the housing fund is the way to go about affordable housing. But the question as to whether we need affordable housing is a fundamental one. And we do need affordable housing. How the government prioritizes that is a different story altogether. But we have an urgent need for decent, affordable housing for low-income people, right? And I think the other thing that keeps coming up is this idea that why should I pay for a house that I'm not going to live in or that somebody else is going to live in? And we have to sort of, as a country, recalibrate what building a fair and just nation looks like. Because the Mamamboga who pays council taxes, for example, from her operation in city council, in city market, her taxes are probably going to guarantee the expressway that she's never going to drive on, right? And so this idea of, do we need affordable housing? Of course we need affordable housing for a certain group of Kenyans. Whether the housing fund is the way to go about it is a different question altogether. The government has a role to play in making sure that everyone has access to decent and affordable housing. And to the health question, let me just add on to this. I don't think the idea of affordable housing is a net zero idea, right? There's obviously gains when people live in decent conditions. What does that translate into in terms of the public health bill for the taxpayer, for example, right? What does it look like when people are more productive? And so we have to kind of think about these questions and sort of see what trade-off we're making. We are probably paying for affordable housing, not necessarily in the housing fund configuration, but there is something to be gained in what the population looks like when it's healthier and decent and so on.